So this is right around our 1 year anniversary of last year when we had the local shelter in place order. And so, of course, there were a lot fewer cases at that time reported in the county. But today, on that 1 year anniversary, there are definitely more cases. And while things are different, businesses are open, events that were canceled last year are happening. So I just wanted to talk to you about, I guess, what your thoughts are on both how far we've come, but also, I guess, whether or not you think we might be jumping the gun since cases and hospitalizations are, of course, worse than they were back when y'all issued that shelter in place order. But it's like the community is no longer reacting in a similar way.
Yeah. Well, that's a good question. It's an interesting way to put it, Megan. You look at, 1 year ago, where were we at with numbers? And 1 year ago, where were we at with hospitalizations? Another way to look at it is 1 year ago, where were we with knowledge, and where were we with experience, with this? And that is night and day different. We've been talking here about some mess ups. We're trying to make sure we get all the data in. And so we've had a lot of lessons learned over this year. And, so this is a different world than we were living in a year ago. There are, and the biggest piece here is the vaccinations. The vaccinations are changing things. And we've seen guidance from the CDC appropriately that reflects that. Hey, as we get more folks vaccinated, and as we're seeing now, the vaccines being open to everybody, which is a wonderful change, and that we've seen more vaccines being licensed, we've seen more of a supply. That is the game changer here. And that does, especially when we talk about, we take the step back of what are we doing all of this for? And it is the vulnerable in the population, is those who are most likely to have severe COVID-19, to require hospitalizations, to require the ICU and ventilator resources, and those who could die from this. And that is what unequivocally we've seen benefit from these vaccines, this vaccination program. And so that's really why we're starting to see more of this. Now, you asked, I think you asked in a way, like, am I comfortable with that? And, we've had to remain humble, this entire time, that's for sure. None of us can predict the future, but I like where we're sitting with our numbers down, with our vaccinations up. That's what I like to see. I don't think we're done, and I don't think we're done vaccinating. I don't think that we can let down our guard completely, but I do think that we can start to liberalize things the way that we've seen the guidance come down. I support that guidance, and so we'll be seeing a lot of questions about spring break. What are the numbers going to be after that? And that's a great question. It'll be interesting to see. We would expect there to be an increased number of cases. But what I really hope and expect that we'll see is that there'll become a broader dissociation with the numbers that we see and the numbers of individuals who end up hospitalized and hospital utilization. And the disparity between those two is going to be the protection of the vulnerable, the protection of the high-risk individuals with vaccination. And of course, empowered with knowledge of maintaining good practices for those who are still at highest risk. And so that's really the hope and the expectation that changes this pandemic, is that, yeah, there's still going to be some cases, but we really hope that the more vulnerable are more protected than they were before. And so we'll see, obviously throughout the summer and into this fall and through the remainder of the spring, if that holds true. But it comes back to that point of more vaccinations. We just have to do that. And a commendable job Chief Stewart and his team, Trad Mills, have been doing over there at the Brazos Center. Did I hear? I think we're up to nearly 20,000 vaccines have been over there. I mean, incredible job that they're doing over there. I mean, just cranking. And Sarah, you might have the number actually better than I do, but it's been a lot of vaccines that they've been given over there. And that's what it's about. And so now that we can open that up into the next, the next phase of individuals. And we've also seen other partners in town able to get more vaccine. There was a time there where no one else could get vaccines with respect to the other providers in town. And now that we've been able to do that, our patients, our community members, our neighbors are having the opportunity to get vaccinated in other places. And so these are all welcome changes, and these are all different from last year. I guess to come back to your original question, Megan. And so that is the hope, moving forward. But I would say that we have reason for optimism, but we're not done yet.
Thank you so much.
Thank you.
All right. Well,